Hi, I'm Jessie Abbott, your host of Valley News Now. Well, there's been a lot of talk recently about President Biden and his cognition and whether or not he will receive cognitive testing. So earlier this week, he responded to this matter, and you can read that story at valleynewslive.com. But you might be wondering, like we were, what is a cognitive test and who should take it? Why should you take it? Where do you take it? And what do the results mean? So first of all, cognition means thinking, learning, remembering, using judgment and language, just kind of the normal things that we do. So you might have heard the term cognitive impairment or cognitive decline, and that means when testing comes back with those problems and there's particular brain functions that aren't working well. So we've all kind of had that experience. You go into a room and you forget something, or you go to Facebook and look for some information, but you get lost scrolling for 15 minutes. So did those kind of things mean you should have your cognition tested? Well, not necessarily, but if you or a loved one is showing changes in what you normally do, it's a good idea to bring that cognitive testing up with your healthcare provider. So things like forgetting appointments and important events that you wouldn't normally forget. Losing things often, having trouble coming up with words that you usually know, forgetting how to use common items or do common tasks that you normally know how to do, losing your train of thought in conversations. Okay, and I know a lot of these red flags, you're starting to think, uh-oh, this is me. But again, it's really about a change in those things. But losing your train of thought or not being able to follow in movies or books like you used to, or feeling increase in irritability or anxiety, usually due to those changes. So cognitive testing alone doesn't diagnose dementia or any other cause, but the test results can show whether you have a problem with how your brain is functioning. And you might need further testing. Your healthcare provider can order the right test to learn more about your condition. Some of those causes of cognitive impairment can be treated. So things like urinary infections or side effects of medication, even depression can cause those symptoms. And those things can be treated, but even if the cause is untreatable, it's really good to know where you're at, and your healthcare provider will be better able to kind of give you tips and give you better direction on your healthcare. And so that proactive testing really helps that you get that early diagnosis and early care. It makes a huge difference in people's health and safety and their quality of life as they get older. So this is a really good argument as to that why you should participate in cognitive testing. And so where should you go? Of course, there's countless things online that you can look at, but really your healthcare provider is always the best. A lot of those tests, even though they're simple and short, they need to be administered by somebody who knows kind of what to do with those results. And so there's lots of different kinds of standardized tests that talk about cognitive impairment and are able to assess where your cognition is at. We've got some of those in the story. What is cognitive testing at valleynewslive.com, but you can check those out. And a lot of those, if you've got people in nursing home care or in the hospital, they use those standardized tests. Many have to do with just repeating certain words or drawing objects or identifying objects. So it's really more of an assessment to somebody's cognition. There's really no harm in taking those tests. It's really only good information that can come from that and better your health care that you get provided to. So you can check that out at valleynewslive.com. And I'm Jessie Ammett, your host of Valley News Now.